Hello everyone, I'm Dr. Linda here at SKIN101. Today we'll be talking about what causes acne. Acne is one of the commonest reasons why patients present to our clinic. That's the reason why we're talking about acne today. There are four major reasons why people break out with acne. But first up, before I get to these major reasons, let's talk about what acne is. Acne is a chronic inflammatory disorder or disease of the skin, usually affecting the pilosebaceous follicle. You might wonder, what is that? What does that mean? So it's actually a part of the skin that consists of the hair follicle, together with sebaceous gland. That's a gland that produces oil that keeps your skin moisturized, and a special kind of muscle. So acne is a chronic inflammatory disease that affects this structure that I just described. Now let's get on to those major reasons why you're breaking out. One major reason why people that are acne prone break out with acne is because they have abnormal desquamation. What is desquamation? So the skin has a way of renewing itself where it sheds off dead skin cells. But for people that are acne prone, this process is abnormal, such that the desquamation process is much slower. So there's a buildup of dead skin cells, keratinocytes, and then they line up the hair follicle and cause a microplug together with the oil or sebum produced by the gland associated with the hair follicle. The second reason why people break out with acne is because they produce excessive oil. It's called seborrhea. Some persons are prone to having excessive oils all over their face or on certain parts of the face. Usually for persons that have combination skin type, other parts of their face is dry, but the T-zone, that's this nose area and the forehead area, is usually oily. That is one of the major causes or reason why people that are acne prone break out with acne. The third reason is hormones. Usually if you notice, people that are acne prone tend to have an onset of these breakouts most times during puberty. And this is because there are some certain or special type of hormones called androgens that have now increased in level because of puberty. And these hormones have a way of increasing the rate at which the sebaceous glands or oil glands that I talked about that are associated with the hair follicle. These hormones tend to increase the rate at which oil is produced from these glands. So these hormones causes abnormal production of sebum or abnormal oil production, and that's the reason why people that are acne prone most times usually have an oily skin, either all over the face like I said, or on the T-zone area. The fourth cause of acne is a bacteria called Cutibacterium acne, or C. acne for short. This bacteria resides on the skin. However, in people that are acne prone, in the presence of the excessive oil production, the abnormal desquamation, it becomes a favorable environment for this bacteria to abound and proliferate. Now, this bacteria, while colonizing this hair follicle or pilosebaceous unit that we had explained earlier, it could cause an inflammatory response, meaning this bacteria secretes some certain kind of chemicals, and your skin responds to it with an inflammatory reaction, and that inflammatory reaction is what shows up on your skin as either pustules, nodules, papules, and cysts. There are other reasons why you could be breaking out. One of such is diet. Usually skimmed milk can trigger or worsen or exacerbate your acne. There are also drugs that could actually cause you acne. Drugs like sedatives, like benzodiazepines, or progestin contraceptives. So there are some certain persons that are placed on a contraceptive and then they notice that they start breaking out. So those are just one of the other causes or reasons why you could break out with acne. There are other reasons apart from the 4 causes of acne that I just mentioned, and this includes endocrine disorders. So there are some disorders where there's a hormonal component to this condition. A classical example of that is polycystic ovarian syndrome. This is a syndrome that comprises of a lot of symptoms affecting different systems of the body. And because there's usually an increased levels in certain androgens, certain hormones called androgens that are secreted. So this particular disease condition could cause some persons acne. Amongst the other causes of acne also include stress. People that undergo stress, either work-related or otherwise, could break out with acne, and this is because stress hormones are released during stressful periods, and this will cause inflammation, and the skin can also respond with inflammation, causing you acne. There are drugs like benzodiazepines, which are sedatives, and progestin contraceptives that could make people break out. Now that we've talked about what causes acne, it's easier to now treat. However, one thing you should have in mind is that in the treatment of acne, it has to be individualized to get the best outcome. Now, for persons, we've talked about the multiple factors that causes acne, so it only makes perfect sense that the approach to treating acne would also be multifactorial. So that means you would have to address the abnormal desquamation, you would have to address the increased oil or sebum production. You'd also have to address hormone levels if there's an hormonal component to the case in that particular patient, and that's why we said treatment of acne has to be individualized. Also, you would have to address the bacteria implicated in acne formation. So now we've talked about what causes acne. In our next video, we'll be talking about how to treat acne. If you found this useful or helpful, please don't forget to like, subscribe, and share. Bye.